What about the intersection of politics and healthcare?
Well, it's huge. You know, the basic problem is that there are very powerful vested interests in this country that are making out like bandits from our dysfunctional health system. And they are the big pharmaceutical companies, the manufacturers of medical devices, and the big insurers. They don't want anything to change. And they call the shots. It doesn't matter whether you're Democrat, Republican, liberal, conservative. You can't get elected to office in this country unless you've made deals with those interests. How's that going to change? You know, I don't think we can expect change to come from our elected representatives. The only way change is going to happen is if there is a grassroots movement in which enough people get angry enough about the situation to begin to change things. Grassroots movements can be very effective, but at the moment, I don't see that happening. I think these interests are very able to manipulate public opinion in the directions they want.
What about Price? What about the man who would be the head of the Department of Health and Human Services and the revelations this weekend about trading stocks?
Right. So Tom Price is a member of Congress. He's been nominated to run the Department of Health and Human Services. It turns out he's been an active trader in pharmaceutical stocks. Thanks to a recently passed law, members of Congress are required to disclose what they trade and when. And we've seen that his stock trades seem to correlate very closely with another member of Congress, Representative Collins. Representative Collins sits on the board and owns a 1/6 share in a small Australian biotech company called Innate Immuno. And Representative Price has also traded in this penny stock from Australia that very few people ever would have heard of at moments that correlate closely with the trades by Representative Collins.
Here is what the real point is. In terms of all of the issues you've raised, the good questions you've raised, you know what it all comes down to? Do you know why we can't do what every other country, major country on earth is doing? It's because we have a campaign finance system that is corrupt. We have super PACs. We have the pharmaceutical industry pouring hundreds of millions of dollars into campaign contributions and lobbying, and the private insurance companies as well. What this is really about is not the rational way to go forward. It's Medicare for all. It is whether we have the guts to stand up to the private insurance companies and all of their money and the pharmaceutical industry. That's what this debate should be about.
If success is measured by return on the dollar, the pharmaceutical industry made a killing, putting pharmaceutical interests in the win column, the swift death of drug reimportation. It would have cost drug makers billions if Americans could buy cheaper drugs from Canada or Europe. Now they can't. Other big winners are the American Medical Association, hospitals, and insurance companies. They spent tens of millions of dollars lobbying on health care this year. That doesn't even count their aggressive campaign in recent days against Medicare buy-in. It would have allowed Americans as young as age 55 to buy into Medicare. But to providers, it could have meant lower payments for medical services all the way around. It's dead.
As just one example of getting what it pays for, look at the Medicare drug benefit. In 2003, Congress passed a Medicare prescription drug benefit that would partially subsidize prescription drugs for seniors. It contained an extraordinary provision. Medicare, in that bill, was expressly prohibited from using its purchasing power to negotiate prices or to set up formularies of the best drugs. It had to pay, said the bill, whatever the companies or the private middlemen chose to charge. To appreciate how extraordinary that provision was, you should know that Medicare does negotiate doctors' fees and hospital payments, but doing the same with prescription drugs, with drug prices, was ruled off the table. You should also know that other government agencies, such as the Department of Defense and the Veterans Affairs system, do bargain for drug prices and get some of the lowest prices in the country. But Medicare, the biggest purchaser of them all, was forbidden from using its purchasing power. The person most responsible for pushing this peculiar bill through Congress was Representative Billy Towson, chairman of the House Energy and Commerce Committee. Shortly after its passage, He retired from Congress, and shortly after that was rewarded by being named CEO of PhRMA, the Pharmaceutical Industries Trade Association, at a salary of $2 million a year.
What a Medicare for All program does is finally provide in this country health care for every man, woman, and child as a right. Now, the truth is that Franklin Delano Roosevelt, Harry Truman, you know what they believed in? They believed that health care should be available to all of our people. Right now, what we have to deal with is the fact that 29 million people still have no health insurance. What the Secretary neglected to mention, not just the 29 million still have no health insurance, that even more are underinsured with huge co-payments and deductibles. Tell me why we are spending almost 3 times more than the British, who guarantee health care to all of their people. 50% more than the French, more than the Canadians. The vision from FDR and Harry Truman was health care for all people as a right in a cost-effective way. We are paying the highest prices in the world for prescription drugs, getting ripped off. And here's the important point. We are spending far more per person on health care than the people of any other country. My proposal: provide health care to all people, get private insurance out of health insurance, lower the cost of health care for middle-class families by $5,000. That's the vision we need to take.
Now, some doctors believe that drug companies don't influence them, but they do. There's been plenty of research showing that. They influence them not only in terms of clinical practice, but in terms of research and education as well. So this has real consequences.